5, we will have a COVID vaccination update by Ms. Stephanie Reese.
Thank you.
Okay. Good morning, everyone. My name is Stephanie Reese. I am the clinical manager for the Delaware County COVID-19 Task Force. Tonight, or this evening, I will present to you some information regarding the COVID-19 vaccinations and testing initiatives and efforts that we have been doing here in Delaware County. As you may already know, as of August 2nd, the CDC moved Delaware County from moderate to substantial level of communication of transmission of COVID-19. As to date, we continue to be at substantial rate as COVID-19 cases and hospitalizations continue to increase. According to the CDC past 7-day data, cases are up by 10.53%. Percent positivity is 4.82%, which is an increase by 0.32% from over last week. Hospitalizations are up by 30.77%. So we ask the question, where do we go from here? As we know, vaccination remains the most effective tool we have to control the spread of COVID-19. So today, the Pennsylvania Department of Health data shows that Delaware County right now has 56.1% of the population fully vaccinated. 6.6% are partially vaccinated. So keeping our residents healthy and safe and educated about vaccines are our number one priority. So the Delaware County COVID-19 Task Force continues to support vaccine initiatives in the county. The Yaden Wellness Center continues to offer all 3 vaccines on 3 different days, Mondays, Tuesdays, and Saturdays, with testing done at the Yaden Wellness Center on Mondays as well. We continue to run a homebound program 1 day a week, and we also continue to support our local school districts, our primary care offices, as well as any other stakeholders who have interest in receiving vaccine and getting it out to the people who they want to get it out to. Some upcoming highlights. This week, we're going to be having 2 community events at the Keystone Wellness Center in Chester. It's a part 2 of our Kids Kick COVID initiative. Thursday and Saturday, we're holding those events. The following week, we're going to have 2 more events in Chester, one at the Chester Charter School and one with the Chester Upland School District Family Fun Day. We're excited to be part of those initiatives, and we continue to support them in their initiatives. Just as some reminders, if anyone in here or anyone knows someone who has their first vaccine and not gotten a second one, I encourage you to still get the second one. It's not too late. Also, as a reminder, if you, coworkers, if anyone not feeling well, please stay home. You know, right now we're having quite a few cases of breakthrough COVID-19. So we just want to make sure everyone stays healthy and safe in their environment. Any questions?
Welcome, Ms. Reese.
Oh, thank you very much. I appreciate it, and I thank you for allowing me to present.
You did a great job, and I appreciate the information. I had a question with regard to, you said we're supporting the schools. What does that support look like?
So it depends on the school district. So what we've been doing, particularly with Chester City, we have been providing vaccines. We have also been staffing in some cases where needed. They've been working closely with Chespin as well. Some other schools, like charter schools, we're actually going out and we're staffing. We're providing the vaccine. We are putting all the information in PASYS. We're going out for second doses, and we're offering first and second doses no matter when we go back. So for example, we're going this week to the Kids Kick COVID event for second doses, but we're still offering first doses. So in terms of school districts, anyone who reaches out and wants some support from us, we're giving it. The William Penn School District, I will be there on August 31st just to set up an information table. You know, so some of our priority is to make sure we're educating, not only in the area of vaccines, but also in other immunizations that the kids may need, other resources the family may need. So that's the type of support we've been providing to our local school districts.
And when you say staffing, you don't mean we're teaching in the schools. You mean we're there to provide vaccination.
Exactly. Yep. So we're providing nurses.
Clinic.
You know, we're running the pods for them.
Okay. Thank you.
Yep, you're welcome.
Ms. Reese, just to clarify, and I always have the same question, but the 56.1% or whatever you said were fully vaccinated in the official numbers, that is without any estimate of people who got vaccinated in Philadelphia or out of state?
That is without, yes.
Okay, so there is something north of that.
There is more to that, and I don't have all that data right at this moment.
But
But
I
that is
think
without.
Okay, but it's somewhere in that, I think, 10%, 15%.
Definitely,
kind of
yes.
range.
Can again, that 56% is of the entire population,
The entire population of Delaware County, yes.
not just adults over 18?
No, not just adults,
Okay.
that's the entire population.
Thank you.
Second question is with regard to the hospitalizations, which to me was the biggest sort of standout number for this week was the increase of 30%.
Yes.
What I've seen nationally is that it's in the range of 95% of people who are being hospitalized today are the unvaccinated. Do you have anything locally? Because what we've seen is really the way this pandemic is playing out is very different from one locale to the next.
Yeah.
Do you have anything about in Delaware County?
I do not have that information broken down to that level at this time. I know, I can tell you that in terms of, if we're speaking just hospitalization for COVID and ICU, the ICUs have not been utilized much in Delaware County. But I don't have it broken down in terms of who's been vaccinated, who hasn't been vaccinated. But I can try to find that information and get back to you on that, if that's okay.
Yeah, I think that really would, because I think it would help reinforce
Absolutely.
because I think sometimes those who are still unbelievably against the idea of vaccination, they raise as a means of throwing smoke in the whole argument that people who are vaccinated are still getting COVID,
Right, I agree.
which is true.
Yeah,
But it's a whole lot less severe of a form of COVID than those who are unvaccinated. And
Right.
so I
And-
think understanding how that's translating into the percentage of people who are being hospitalized in Delaware County,
Right.
if that's information we can get, I think it would be really helpful.
okay, yep, I agree.
Hi, welcome. I did have a question. It's really more clarifying for people, I think, because we've spoken a little bit to what we're able to do to support school districts, but I think it's important that people understand the limits of what we can do without a health department.
Right.
So, for example, we are not getting, as you said, we're not getting quite as much visibility into some of the details of hospitalization. We are also not on a regular basis and not on a particular, I know Dr. Taylor had shared with council zip code data, but we're not necessarily seeing school district data the way we were seeing it with the assistance to the Chester County Health Department, right?
Right, that's correct.
And the state is not breaking that information down for us at this point?
No, not at this time.
So again, this is a benefit that the county will have and additional support that we would be able to offer school districts with our own health department.
Correct.
Okay, thank you.
Hello.
And it's not, believe me, I'm saying that just to illustrate the fact that the health department is not just something nice to have, but there is a gap in our information.
Absolutely.
And it's a function of not having that facility yet. And I appreciate everything that our Department of Intercommunity Health is doing, and Dr. O and you and your team, and we've got a really robust vaccination team that is still going out and serving these pop-up functions.
Right.
So it's not meant as a criticism, just to underscore the fact that we still have a ways to go.
Yeah, absolutely. And I thank you for that. I appreciate you chiming in.
Just one last point to follow on to Ms. Ruther's there. I think we've heard from a number of school board members who are incredibly frustrated now that they are, and as has been raised previously, that they are not public health experts,
Right.
and absent something any greater than a suggestion, an encouragement by the governor to wear masks indoors without a mandate,
Right.
we at a local level have zero authority to do anything beyond that.
And it's-
Counties that don't have public health departments have no authority whatsoever. And so it really is falling to individual school boards to make that decision as to how strongly they'd like to go as it relates to mandating mask wearing. Again, absent something that occurs perhaps between now and the beginning of school year by the president, by the governor, county council isn't going to be able to do anything. We don't have any authority whatsoever here. It ended when the contract with the Chester County Health Department expired, and we are now, we're information. We can provide our own personal opinions, but we have no authority.
Right, yep.
Thank you, Ms. Reese.
All right, thank you. Have a good night.